Next up, we have Permaul Flores. She is at University of Toronto, and she will be telling us about mapping health for a climate-resilient future, GIS applications in Toronto. Hannah.
Good morning, everyone. Well, there's one other thing that I would like you all to know about me, and actually, 22 years ago, I was born in the old Women's College Hospital building. So it's good to be home. So without further ado, does anyone recognize this? Going once, going twice? Okay, time's up. This is the Johns Hopkins COVID-19 dashboard, and for 2 years, millions of people checked this map daily. It showed us what health data becomes when it is geographically considered, and it becomes actionable, it becomes urgent, and it becomes impossible to ignore. And that is the power of GIS, Geographical Information Systems. So what is GIS? GIS essentially is spatial analysis software that layers data on top of geography. Think of the company Esri as the Microsoft of the geospatial world. And their ArcGIS platform lets you stack data layers on top of each other and aggregate them, like satellite imagery, census demographics, sensor networks, health records, all spatially referenced. And you can overlay these layers to run spatial statistics, to identify patterns invisible to the naked eye as well. You can buffer different zones and look at hotspot analysis, spatial regression. This turns location data into public health intelligence. So now I'd like to draw your attention to the conglomerate of points on the right side. On June 6, 2025, Toronto's air quality index hit 173, ranking us second worst in the entire world. And that would be compared to the map on the left, which actually shows the normal air quality index results from this past Wednesday. So let's talk numbers. PM 2.5 refers to particulate matter that is smaller than 2.5 micrometers, which is about 30 times smaller than the thickness of a human hair. And Environmental Canada's air quality health index reached above 10, meaning very high risk. And the WHO guideline for safe annual exposure is 5 micrograms per cubic meter. And during June's wildfire smoke events, we were breathing air 10 to 15 times that level. So this map shows purple air sensor data across Toronto, which I also use in my own research. These low-cost monitors create hyper-local networks, revealing that air quality isn't uniform. In downtown cores, industrial corridors, and areas near highways show consistently elevated PM 2.5 levels. And this isn't just June's residual wildfire smoke. This is also chronic exposure. And that correlation we can see is direct. So now I want you to think about my context here, coming from a bachelor's degree, a double major in biology and forest conservation science. You'll see this connection here. So I want you to imagine standing at your window. Can you see 3 trees? Does your neighborhood have 30% canopy cover? Are you within 300 meters of a quality green space? So this is what's known as the 3-30-300 rule, which is an evidence-based guideline for healthy urban living. And research shows that people meeting these criteria have better mental health outcomes, less medication use, and fewer visits to mental health professionals. Through my internship this year with the National Geographic and the Nature Conservancy, I mapped Toronto's green space access using GIS spatial analysis, overlaying tree canopy data with census demographics and health outcomes, and this map shows every single park that is registered in the city of Toronto. The results reveal that environmental injustice with geographic precision is possible, and that in Toronto's lowest income neighborhoods, only 12% of these neighborhoods actually meet all of these 3 criteria. And in high income neighborhoods, the statistic is actually 60%. And the health implications are measurable. Neighborhoods failing the 3-30-300 rule shows 23% less or higher rates of cardiovascular disease and 31% higher rates of type 2 diabetes. So trees aren't amenities, they're determinants of health as well. Now I want you to focus on this thermal map of Toronto as well. It is a choropleth map, and it is showing you the context of heat islands in urban settings. And in areas around places that are green landmarks, such as Hyde Park, we see average temperatures of about 21.5 degrees Celsius, whereas if you go to North York or to Scarborough, where you have these concrete-heavy neighborhoods and industrial corridors, you actually see that the temperatures increase to an average of 32 to 33 degrees Celsius. And that's a 12-degree difference within the same city that you can see here. So this isn't just uncomfortable for people, but it's actually deadly. By 2050, Toronto's summer maximum temperatures are projected to reach 38 degrees Celsius on average. And the solution here is measurable. A single mature tree cools surrounding areas at around 2 to 3 degrees Celsius and reduces building energy costs by about 30%. So with all of these maps that I've shown you today, I'd like you to distinguish the fact that environmental health is not distributed equally across Toronto. And if you scan the QR code, you can look into more of my work on mapping, and I will leave you with this, that the future of public health lives in this intersection of place and data, and that where we are says a lot more about who we are as people. Thank you.